Whether you just received a diagnosis of hypermobile Ehlers-Danlos Syndrome or HSD, maybe you've known for years, or you suspect one of these diagnoses explains many of your symptoms, it can sometimes feel overwhelming or frustrating to find the right doctor or provider for you. In this video, I'm going to simplify the process for you by sharing my top 5 methods to help you find the right doctor for your needs, one who will support you and help you move forward in your hypermobility journey. My name is Chris Sovey. I'm a physical therapist and registered nurse who specializes in treating hypermobile Ehlers-Danlos Syndrome and Hypermobility Spectrum Disorders. I'm going to jump right into my recommendations, and for context, I'm going to assume that you've already tried to find a provider on your own and didn't feel satisfied with who you saw, or you're not even sure where to begin. I'm going to talk about the pros and cons of each approach so you can decide which method is right for you. Regardless, you may, unfortunately, find that there's a bit of trial and error before you find the right person. Also, this is assuming you're looking for a primary care provider or someone who can help you obtain a diagnosis of Ehlers-Danlos Syndrome. By the way, if you want to learn exactly how Ehlers-Danlos Syndrome is diagnosed for your own knowledge, check out our simple breakdown in the other video in the top right corner of your screen now. We break down step by step a complex topic into simple steps so you can be certain you understand the diagnostic process. So back to the video. Option 1 is to ask for recommendations in local support groups. These can usually be found on various social media platforms, particularly Facebook. This is usually one of the best places to start, as you won't have to be the first one to see a particular provider in your area. You can typically find these support groups by logging onto a social media platform such as Facebook and typing in Ehlers-Danlos Support Group followed by the city name, or even Ehlers-Danlos Support Group and then the state name. There's really little downside to this approach because you usually get community consensus. Option 2 is to visit the Ehlers-Danlos Society's website and access their healthcare provider directory at ehlers-danlos.com. If this is your first time to the website, hover over the I am an individual and click Explore. Then click Find a doctor/therapist. Before clicking Find a doctor/therapist, you can also see on this same page that there's a link to find a support group, which takes us back to option 1. One of the biggest disadvantages of option 2 is that, as of this recording, the directory does not require any type of screening for the quality of services provided by the healthcare professionals listed. So if you do use this option, be sure to follow up with some research by reading reviews or asking others with hEDS or HSD in your community. Option 3 is to ask related local providers, such as physical therapists. If you're already working with a physical therapist or an osteopathic manipulative medicine physician, these types of providers often are aware of physicians or providers who may assist you in your journey of finding a doctor. This is perfectly an acceptable option. Just be sure to do some additional vetting on your own by looking at reviews and asking the community about their experiences with those providers. Option 4, if none of the above options are available to you or you're not satisfied with what you find, you may begin searching for local rheumatologists as a starting place. While this is not my favorite method, it is an option. You can call up local rheumatologist offices and ask how commonly they diagnose Ehlers-Danlos syndromes. A major downside to this is the wait time. Most rheumatologists have waiting lists of 5 months or more. But on the other hand, you may encounter this regardless of what approach you choose. Lastly, option 5, another creative approach, is to work with your primary care provider or other provider, such as an osteopathic manipulative medicine provider. If you're used to taking charge, you can be your own advocate. If you feel that your current primary care provider is curious, empathetic, and open to listening to you, this may be enough to help you obtain a formal diagnosis. See our other video in the upper right corner of your screen now that shows the diagnostic criteria for hypermobile Ehlers-Danlos Syndrome and how it's broken down. Many people mistakenly believe that obtaining a hypermobile Ehlers-Danlos Syndrome diagnosis requires genetic testing. As of the making of this video, this is not the case. Sometimes genetic testing is used to rule out other subtypes or similar looking disorders, but many times this is not necessary if you meet enough of the 2017 criteria. This could, of course, change if you're watching this video at a later time. Genetic research is currently being done to find specific markers for hypermobile Ehlers-Danlos syndrome, but it's not included as an absolute necessity in all cases. Don't let this stop you from obtaining a diagnosis sooner versus later. So those are my top recommendations to help you find the right provider for you. What sorts of things have you learned in your own search for a provider? Have you already found someone that you like? Are you still struggling to find the right person? What advice would you give to another viewer who is currently looking for a provider themselves? If you found this video helpful, we're certain that you'll like some of the other things we're doing over at hypermobilitypt.com, where we've built a private community to help support those with hEDS and HSD in their journeys. It's free to join, and we encourage you to check it out. Check back next week as we will be teaching about one of the most common subjects we get asked. How do I fix my ongoing neck pain and headaches? This video will be especially helpful if you have or suspect you have upper cervical instability. Thanks again for watching, and be sure to subscribe, like, and share the video with someone who you think may benefit.